Lung cancer is the leading cause of cancer deaths worldwide. It claims millions of lives each year, casting a shadow over families and communities. This aggressive disease affects the lungs, the organs responsible for breathing. Lung cancer's impact extends beyond individual suffering. It places a significant burden on healthcare systems globally, demanding extensive resources for treatment and care. The economic impact is also substantial, with lost productivity and healthcare costs adding up. Despite the grim statistics, there is hope. Advances in medical research have led to new treatments and improved survival rates. Raising awareness about lung cancer, its risk factors, and the importance of early detection is crucial in the fight against this deadly disease. By understanding lung cancer, we can empower ourselves and our loved ones to make informed decisions about our health. Knowledge is power, and in the case of lung cancer, it can be life-saving. Lung cancer originates in the lungs, the organs responsible for taking in oxygen and releasing carbon dioxide. It occurs when abnormal cells in the lungs grow uncontrollably, forming tumors. These tumors can interfere with the lung's ability to function properly, making breathing difficult. There are two main types of lung cancer: small cell lung cancer and non-small cell lung cancer. These types are differentiated by their microscopic appearance and growth patterns. Non-small cell lung cancer is more common, accounting for about 85% of lung cancer cases. Lung cancer can spread to other parts of the body, a process called metastasis. This can occur through the lymphatic system, the bloodstream, or by direct extension. When cancer spreads, it becomes more challenging to treat. Understanding the basics of lung cancer is crucial for early detection and treatment. Recognizing the early signs and symptoms can be life-saving, increasing the chances of successful treatment and survival. Smoking is the leading risk factor for lung cancer, accounting for about 80% of cases. The harmful chemicals in cigarette smoke damage the DNA in lung cells, increasing the risk of cancer development. Cigarette smoke contains over 7,000 chemicals, many of which are carcinogenic, meaning they can cause cancer. These chemicals irritate and inflame the lungs, leading to chronic obstructive pulmonary disease, which further increases lung cancer risk. The longer a person smokes, the greater their risk of developing lung cancer. The number of cigarettes smoked per day also plays a role, with heavier smokers facing higher risks. However, even light smoking or short-term exposure to cigarette smoke can be harmful. Quitting smoking is the single most important step smokers can take to reduce their risk of lung cancer. The benefits of quitting smoking begin immediately and continue to grow over time. While smoking is the primary risk factor for lung cancer, several other factors can contribute to the development of this disease. These include exposure to secondhand smoke, radon gas, asbestos, air pollution, and certain genetic predispositions. Secondhand smoke, the smoke inhaled from other people's cigarettes, cigars, or pipes, contains many of the same harmful chemicals found in first-hand smoke. Exposure to secondhand smoke increases the risk of lung cancer in both smokers and non-smokers. Radon is a naturally occurring radioactive gas that can seep into homes and buildings from the ground. It is the second leading cause of lung cancer after smoking and is a significant risk factor for non-smokers. Asbestos, a group of minerals once commonly used in insulation and building materials, is a known carcinogen. Long-term exposure to asbestos fibers can scar lung tissue and increase the risk of lung cancer, particularly a type called mesothelioma. Air pollution, particularly from vehicle exhaust and industrial emissions, contains harmful particulate matter and gases that can damage the lungs and increase cancer risk. Genetic factors can also play a role in lung cancer development, with certain gene mutations increasing susceptibility to the disease. Section 5. Decoding the disease, types and stages of lung cancer. Understanding the different types and stages of lung cancer is crucial for determining the best course of treatment and prognosis. As mentioned earlier, the two main types of lung cancer are small cell lung cancer, or CLC, and non-small cell lung cancer, or NSCLC. SCLC is a more aggressive type that grows and spreads rapidly. It is strongly linked to smoking and often diagnosed at a later stage. NSCLC encompasses several subtypes, including adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. These subtypes have different characteristics and growth patterns. Adenocarcinoma is the most common type of lung cancer, often found in people who have smoked in the past or never smoked. Staging in lung cancer refers to the extent of the disease and whether it has spread to other parts of the body. The stage is determined through imaging tests, such as CT scans and PET scans, and sometimes with biopsies. The stages of lung cancer range from stage 0, where the cancer is localized and hasn't spread, to stage 4, where the cancer has metastasized to distant organs. The stage at diagnosis plays a significant role in treatment decisions and survival rates. Section 6. Recognizing the enemy within lung cancer symptoms. Lung cancer often doesn't cause noticeable symptoms in its early stages. As the disease progresses, symptoms may appear, and it's crucial to recognize them and seek medical attention promptly. One of the most common symptoms of lung cancer is a persistent cough that doesn't go away or worsens over time. This cough may be dry or produce blood-tinged sputum. Shortness of breath, wheezing or chest pain are other common symptoms. Some individuals with lung cancer experience hoarseness, difficulty swallowing or swelling in the face or neck. Unexplained weight loss, fatigue and loss of appetite can also be signs of the disease. It's important to note that these symptoms can also be caused by other conditions. However, if you experience any of these symptoms, especially if you have a history of smoking or exposure to other risk factors, it's essential to see your doctor for a proper diagnosis. Section 7. Fighting back treatment options for lung cancer. Treatment for lung cancer depends on several factors, including the type and stage of cancer, the patient's overall health, and their preferences. Treatment options may include surgery, chemotherapy, radiation therapy, targeted therapy, and immunotherapy. Surgery is often the primary treatment for early-stage lung cancer that hasn't spread to other parts of the body. The type of surgery depends on the location and size of the tumor. In some cases, a portion of the lung, a lobe, or the entire lung may be removed. Chemotherapy uses drugs to kill cancer cells or stop them from dividing. It can be used before surgery to shrink tumors, after surgery to kill any remaining cancer cells, or as the main treatment for advanced lung cancer. Radiation therapy uses high-energy rays to kill cancer cells. It can be used alone or in combination with surgery or chemotherapy. Targeted therapy uses drugs that target specific molecules involved in cancer cell growth and survival. Immunotherapy helps the body's immune system recognize and attack cancer cells. It has shown promise in treating certain types of lung cancer, particularly in advanced stages. Section 8. Time is life. Early detection saves lives. Early detection is crucial in the fight against lung cancer. When detected early, before it has spread to other parts of the body, lung cancer is more treatable and the chances of survival are significantly higher. Screening for lung cancer is recommended for individuals at high risk, typically those with a history of heavy smoking. The U.S. Preventive Services Task Force recommends annual low-dose CT scans for adults aged 50 to 80 years who have a 20-pack-year smoking history and currently smoke or have quit within the past 15 years. Early detection through screening allows for timely intervention, increasing the likelihood of successful treatment and long-term survival. It is essential to talk to your doctor about your risk factors for lung cancer and whether you qualify for lung cancer screening. Section 9. Prevention is key reducing your lung cancer risk. While not all cases of lung cancer are preventable, there are steps you can take to reduce your risk of developing this disease. These include avoiding smoking, staying away from secondhand smoke, testing your home for radon, and being cautious around asbestos. If you smoke, quitting is the single most important thing you can do for your health. There are many resources available to help you quit, including counseling, support groups, and medications. Testing your home for radon and taking steps to reduce radon levels if they are high can significantly lower your risk of lung cancer, especially if you are a non-smoker. If you work in an environment where you may be exposed to asbestos, take proper precautions, such as wearing protective gear. Maintaining a healthy lifestyle, including eating a balanced diet, exercising regularly, and limiting alcohol consumption, can also contribute to overall health and well-being, reducing your risk of developing lung cancer and other chronic diseases. Section 10. Join the fight. Spread awareness, save lives. Lung cancer is a global health issue that requires a collective effort to combat. By spreading awareness about lung cancer, its risk factors, and the importance of early detection, we can empower individuals to make informed decisions about their health. Share this information with your family, friends, and community. Encourage your loved ones to quit smoking and support them in their journey to a healthier life. Advocate for policies that promote lung health, such as smoke-free environments and access to smoking cessation programs. By working together, we can raise awareness, support research, and ultimately save lives. Let's unite in the fight against lung cancer and create a future where this devastating disease no longer claims the lives of our loved ones.